This is the Don't Hide the Scars podcast, presented by Pain, Parents and Addicts in Need. Welcome to Pain's Don't Hide the Scars podcast. I'm Jason LaChance, and I'm joined by the founder of Pain, Mr. Flindt Andersen. How are you, good sir?
I'm well, Jason. How are you doing?
I'm good, relaxed. Got one of my little Disney venture vacations to clear the mind and raring to go.
I like it. I like it.
Yes, sir. Yes, sir. Well, where I want to dive in is an area that I think people um, don't think about and don't talk about. And I honestly have to give credit to you here because I didn't think about and I didn't talk about till prior to getting to know you, working with you at Pain and attending where you've spoken to audiences of varying size from the 20s to the thousands about the long-term ramifications around addiction that just doesn't get talked about. People talk about, obviously the financial and the career and the legal, but they don't talk about the health enough.
They don't. They really don't. It's interesting you bring this up because the health issues are so vast. And of course, when you're sitting at a young age, it's not something you think about. And if you're a parent of somebody that's young, you're not going to think about those for them either.
Mm-hmm.
So it's something that needs to be discussed. It's like anything else in addiction today. The full story is not being told. That simple.
Yeah.
That simple.
Yeah.
No. Yeah. So where do you want to start? What do you want to start with? Just in general, we
let's
can
let's
talk about.
go let's go down the path of let's go like the opioid addict and what there, because that, definitely for you a personal experience, and I'll speak to the alcohol aspect and what I experienced, and we can fill everything in between as we both are pretty unfiltered people and honest about those ramifications that we've seen.
Yeah. Look, like you said, the ramifications are vast in this, and people have to remember that once somebody becomes an opiate addict, um, everything about you changes. And one of the things that really goes, right in the toilet fairly quickly is one's diet.
Mm.
You're basically, you live your life around sugar,
Mm.
around things that are sweet. You pretty much, I have to say, as a true opiate addict, you pretty much give up the alcohol side to this because the alcohol actually ruins the opiate buzz.
Mm.
Uh, but that diet starts to change immediately. And I've said this to parents for quite some time. Pay attention to what they're eating. Now, we all know kids are going to eat crap. Okay, they're going to eat chips, they're going to eat candy, they're going to drink sodas, they're going to do those things. But I'm talking about amounts that you haven't seen before. There's a great scene in the movie Michael, the old one with John Travolta, where he's sitting in the kitchen right at the beginning of the movie, and he's got a bowl of Frosted Flakes there, and he's literally dumping mounds of sugar on the sugar Frosted Flakes. And of course, when I saw that movie, I was using, and
Right.
I'm watching that thing going, yes, sir. Okay, because that's what I used to do. So your soda intake increases, your candy consumption increases. Opiate addicts probably strict to chocolates more than a hard candy.
Mm.
So you have to look. You have to look for that usage. You have to look for candy wrappers under the bed,
Mm.
soda cans under the bed, because that's where kids keep them. Now, in the meantime, what happens with that? Again, stands to reason. The teeth start to be affected by the sugar. Now, they're not going to see a lot of that teeth problem in a teenager, but as that child hits their 20s, sometimes a little bit older, boy, the teeth issues are going to fly. The other side to that is the other end of the body, where here comes the constipation due to the opiate use. That is one of the main downfalls to taking opiates. For those that have taken them because of a surgery, you'll know. Now, I want you to imagine you're an opiate addict and you're taking those on a constant basis. Just imagine what that's doing to your bowel system.
Right.
It throws it totally off. Now you cannot do what you need to do in order for the body to function normally. So you're taking different medications, over-the-counter medications, to make you go to the bathroom. And that's not normal. Yeah. Now you get used to taking the laxatives. You get used to taking those things to where now you're not even doing it properly, because whatever ingredients, good ingredients you're putting in your body, that's leaving the body. So do you see, I don't know if you want to call it a dichotomy, but do you see how everything comes into play here, and it all comes down into one thing, which is bad.
Yeah.
Right. To put it mildly. So that's only one issue.
Yeah. Yeah. You're starting to shut down the normal functions of your body at a very premature rate.
New Perceptions North, the premier drug and alcohol treatment and recovery center in Central California. A full continuum of medically supervised top quality care with programs for detox and patient residential treatment with dual diagnosis, intensive outpatient treatment, sober living support groups, and more. New Perceptions North provides adult men and women with the highest caliber of professional health care, treating each client with compassion and respect, in a safe, comfortable environment to begin the process of recovery to proudly create and sustain a life without addiction. Call 559-978-1507 or visit newperceptionsnorth.com.
If we're just talking in the digestive tract alone, let alone what it does to gut biomes and everything else, which was, a big thing. Especially I'll mirror it back to my struggles around alcohol, was definitely happening. We all know, all of us that were drinkers, what tended to happen sometimes after that big night. If you did eat something, which I wasn't eating much near the end, your body wants to flush it out. That's why things like colon rectal cancer, very common thing for alcoholics to end up with, in addition to all the other ones and the effects on, of course, the brain, the kidney, the liver, but people always forget too about the heart, which I'll, ping pong it back to you, the amount of damage that an opioid does on the heart.
It does a tremendous amount of damage on the heart. And I want to back it up just 1 second. What goes along with that opioid use is smoking. And a lot of kids smoke anyway. But now that smoking increases, so they could be smoking. I mean, my smoking tripled during my opiate use, to where I was smoking 3 packs a day. And so what if you don't think that's going to have a long-term effect on your breathing,
right,
on your heart, on everything else that's going on inside of you? You're nuts, because it by the way, it has an effect on the teeth as well, the inside of the mouth, all of that. So, but you brought up the heart issues, and yes, the heart issues not everybody is going to go through heart issues, but there's a large amount that do. And so my point here is, why go through that if you don't have to, right? I've had 2 open heart surgeries because of my opiate use, but I want people to remember that was also because of my diet and because of my lack of exercise, and all of that comes into play. So now I am in a permanent AFib. Always. They've tried to shock my heart into normal sinus rhythm on 2 different occasions. That has failed. So now I have had to take medication for the last 25 years, and I continue to take it in order that I don't stroke out because of the AFib that I have going on. So, like we said, there's plenty more of this that goes on that is not talked about, and I don't understand why it isn't.
Yeah.
I don't understand why physicians will not even mention that to their clients when they are prescribing a narcotic. Now, they will on occasion, but not every time, they will explain the constipation side to this to their patients. But most everybody goes, I can handle that.
Right.
You know, no, there comes a point where I'll say it because my life is an open book. They had to do surgery on me.
Yeah.
Because of the damage that I caused, because I couldn't go and then had to go, and surgically everything had to be configured, I guess,
Yeah.
is the way to put it. But the body's an amazing thing. You know, everything is healed. I don't have problems with that anymore. For the most part, the heart is the only thing that I've got a real issue with. Mm-hmm. You know, but it's not to say that those things aren't going to continue to get worse, because every body is different.
Yeah.
Mine's different than yours. Yours is different than so-and-so's. And we just don't know. So again, the majority of the point here is if you're using, be aware of what this stuff is, because it is coming.
Mm-hmm.
It's not a matter of anything but when it's going to hit you, and it can hit you later on in life as well, because again, as we get older, things happen. We know things are not always going to be 100%, and with our addiction, we're just increasing that to wind up even more detrimental to us.
Yeah, absolutely. Well, and we've seen it across the board with the variety of substances, and I definitely know that, you know, the first thing when I really was honest with my doctor around my issues around alcohol was because colon cancer ran in my family at a earlier age than they normally recommend. Went and had a colonoscopy, as well as getting a good heart check, because the alcohol does a tremendous amount of damage to your heart. Everybody knows the liver and the kidneys, right? The liver, thank goodness something could be done. And for me, luckily, those two organ groups functioning perfectly, but, you know, still definitely did some damage to my gut and my digestive tract for sure. Ended up with diverticulosis, so not litis, but so the small little hole pockets. And I'm sure in conjunction to my alcohol consumption, my diet was absolutely horrible too, because I had the justified brain of, I'll just eat another greasy hamburger and that'll make everything better, right? So you make such a good point around, you know, it's not just the consumption of it and the external factors, but it's what then our decision making becomes too around it. Because we certainly don't exercise, we certainly don't eat right. We, you know, consume the heck out of the sugar. I know for me, when I finally was doing the work to remove alcohol from my life, boy, that desire for sugar was like 50-fold. And I still get a little bit of that sweet tooth every now and then, which I give myself some space for it. You know, I'm not trying to look like Arnold Schwarzenegger. That'll never happen, you know, in his prime. But it's important for people to know and understand the long-term consequences. You know, it's not just the jails and institutions, you know, or that potential, and depending on what your substance is, death. It's these other things that are going to come and definitely destroy your quality of life. You know, there's a reason when I remember a bartender friend of mine always walk in and say, "What's your poison today?" And I would laugh about it. In reality, that's exactly
Right.
what it is. That's all it is.
Yeah.
You know, for men, it's definitely that for people in general, the colorectal cancer with alcohol, stomach cancer for women increases breast cancer. For men, they're getting more data around testicular and prostate cancer. Like all these other factors, it all starts to play in when you are consuming a poison. And I don't just mean alcohol. Like an opioid was, if properly used upon prescribed, 10 days max.
Right. Right, Max.
Yeah.
Exactly. Yeah, exactly. The other thing that needs to be talked about is what the liver does, because
Mm.
as we get older, And what I mean by that is I'm talking sometimes 30s, mid 30s, 30 to 35. That as we start to reach that age and to get older, we have to take certain medications.
Mm-hmm.
Now, cholesterol medication, that is the higher your dose of cholesterol medications, the harder it is for the liver to process. So if you're taking cholesterol meds, if you're taking other medications, and again, I'm not sure which ones, but it stands to reason that if you're taking those medications while you're drinking or while you're using, now it's going to cause the liver to even work harder to try to get rid of those things in your body, because that's what the liver does. Everything goes through the liver, and so and remember, short of a liver transplant, you ain't gonna make it.
Mm.
You're not gonna make it. Can't function without a liver.
Mm-hmm.
So it's a lot of, and again, we haven't even got neck deep in the teeth issue, and what that's all about, or methamphetamine issue, or cocaine use, and what those things do to the brain itself.
Yeah.
Quickly, methamphetamine, actually, I've seen PET scans that of the human brain, that parts of that human brain are eaten away, because in essence, what you're putting in your body is basically under your kitchen sink. It's all chemicals, and so that doesn't grow back either. That does not grow back. So once that part of you is gone, it's gone forever.
Yeah.
And but there's so many people out there that think, oh, it's not going to happen to them. It can't happen to them for whatever the reasons are. And yes, it can, and it does. I mean, you talk about the snowball effect. Now it's a health issue. Now it's a health issue for those, I'm sorry, but for those tax-paying citizens that have to cover the cost of all this stuff. It's like overeating or anything else. It always flows downhill. Somebody has to pay for it, no matter who you are.
Mm-hmm.
Whether it's, it has to get paid for. So I just hope that people understand that we're not trying to scare somebody here too bad. What I'm trying to do is, and what you are trying to do is, we're trying to give them information that they can go back, whether it's to their loved one or whoever, and at least know that this is the possibilities of what can happen here. So maybe you'll try a little bit harder, to help your loved one get a handle on this thing and get them help as soon as you possibly can.
Absolutely. Absolutely. Yeah. Speaking of, if people want to reach out to us, Flindt, of course, painnonprofit.org, and the phone number to call?
559-978-9239, 24 hours a day, 7 days a week.
That's right. Unlike other places we pick up, huh?
We pick up, yes.
Yes. So again, thank you for listening. Like I'll mirror what Flindt said. We want to educate you, and sometimes the education and the facts are a little bit scary, but they're to be taken serious. So please do. If it's not you, but a loved one that's struggling, share this with them. Let them hear it from a gentleman that I have the most respect, has been an expert in this field for decades now. And as I continue to become more educated myself and understand, these are all serious things. But you change that trajectory of your life early enough, positive things start to happen, and it includes Absolutely. That health. So thank you, Mr. Andersen. Appreciate you as always.
Thank you, Jason. Appreciate you as well, my friend.
And thank you for listening to Pains Don't Hide the Scars podcast. Hit that subscribe button, leave a rating and a review on whatever platform you're on, or venture on over to our YouTube page if you're not watching along there. It's youtube.com/@painnonprofit, and hit that subscribe button today.